Welcome to our presentation on cancer genomics, where we explore how genetic insights are transforming precision medicine. In the next slides, we'll unpack what cancer genomics means, why it matters, and how recent advances are changing diagnosis, treatment, and research. Sit back as we introduce the big picture and set the stage for deeper dives into genetics, technology, and clinical impact. This slide outlines the roadmap for our talk, covering an introduction to cancer genomics, the genetic alterations driving cancer, the technologies that reveal those changes, real-world applications, current challenges and future directions, illustrative case studies, and a concise summary. Think of this as our navigation guide so you know where we're headed and how each part connects. To start, let's define cancer genomics and why it's important. This field studies the genetic changes in tumors to understand how cancer begins, evolves, and responds to therapy. We'll look at how mutations and other alterations distinguish cancer cells from normal ones, and why decoding those changes enables earlier diagnosis, targeted treatment, and better patient outcomes. Cancer is essentially uncontrolled cell growth caused by genetic mutations, and cancer cells show features like unchecked replication, evasion of cell death, and invasiveness. Genomics helps us pinpoint the specific mutations and molecular pathways driving these behaviors, which supports more accurate diagnoses and tailored therapies, ultimately improving how clinicians manage the disease and how patients respond to treatment. At the heart of genomics is the study of an organism's complete DNA sequence and the tools we use to analyze it. Genomic techniques range from sequencing and microarrays to databases that catalog cancer mutations, and together they let researchers identify key genes, track expression changes, and link genetic alterations to disease mechanisms and potential therapies. Moving into genetic alterations, this section focuses on the types of changes we see in tumors and how they drive cancer behavior. We'll examine mutations, structural chromosome changes, and epigenetic shifts, plus the distinction between mutations that actively drive cancer versus those that are incidental. Understanding these differences is critical for diagnosis and therapy selection. Genetic changes in cancer come in several forms, including point mutations or small insertions and deletions that alter gene function, larger chromosomal aberrations like translocations and duplications that disrupt genomic architecture, and epigenetic modifications such as DNA methylation and histone changes that alter gene expression without changing the underlying DNA sequence, all contributing to tumor development. Not all mutations are equal, and distinguishing drivers from passengers matters clinically. Driver mutations directly promote tumor growth and are often recurrent across patients, while passenger mutations hitchhike without functional impact. Identifying drivers relies on patterns of recurrence, known functional effects on oncogenes or tumor suppressors, and experimental validation to guide targeted therapies. Next, we'll explore the technologies that make cancer genomics possible, from sequencing platforms to single-cell analysis. These tools vary in scale and scope but collectively enable us to detect mutations, measure gene expression, and profile tumor heterogeneity, forming the technological backbone for precision oncology and ongoing research into cancer biology. Next-generation sequencing has revolutionized how we study cancer genomes. Whole genome sequencing gives a comprehensive view of all genomic changes. Whole-exome sequencing focuses on protein coding regions to find actionable mutations more cost-effectively, and RNA sequencing reveals gene expression patterns, novel transcripts, and splicing events that inform biology and therapeutic targets. Beyond NGS, a range of genomic technologies complements our analyses. Microarrays allow high-throughput gene expression and variant screening, PCR-based methods provide sensitive detection of known mutations, and single-cell genomics reveals cellular heterogeneity and microenvironment interactions, all crucial for refining diagnosis and developing targeted therapies. Now we'll look at how genomic knowledge is applied in the clinic, from discovering biomarkers to guiding therapies and monitoring disease. Cancer genomics supports personalized treatment strategies, helps overcome drug resistance, and enables early detection and prognosis prediction, all of which contribute directly to improving patient outcomes and tailoring care. Genomics plays a central role in precision medicine by enabling biomarker discovery and personalized treatment choices. By profiling tumors, we can match patients to targeted therapies, predict likely resistance mechanisms, and design combination strategies to improve efficacy and minimize side effects. helping clinicians make more informed decisions about each patient's care. For diagnosis and prognosis, genomic profiling enables earlier detection through mutation signatures, helps stratify patients by likely outcomes using genomic markers, and supports real-time monitoring of disease using circulating tumor DNA. These capabilities improve diagnostic accuracy, guide treatment adjustments, and offer a clearer picture of tumor evolution over time. While promising, the field faces significant challenges and open questions that we must address to realize its full potential. Here we'll discuss technical, interpretive, and ethical hurdles that limit broader implementation and point toward future directions like multi-omics integration, liquid biopsy improvements, and responsible use of AI in genomics. Current limitations in cancer genomics include high costs, variable sequencing accuracy, and computational bottlenecks when handling massive datasets, all of which complicate real-time clinical use. Interpreting complex genomic data is also difficult due to tumor heterogeneity and variant ambiguity, and ethical concerns around privacy and consent require careful policy and governance. Despite these challenges, several promising trends are emerging. Integrating multi-omics datasets aims to provide a fuller view of tumor biology, liquid biopsy techniques enable less invasive monitoring, and artificial intelligence is improving pattern detection and predictive modeling, although each approach brings its own technical and ethical considerations. Next, we'll examine case studies that show how genomics has influenced care, focusing on breast and lung cancer to illustrate practical applications. These examples highlight how genetic profiling has identified actionable mutations, guided targeted therapies, and improved clinical decision-making, demonstrating the tangible benefits of integrating genomics into oncology. In breast cancer, common alterations like TP53 mutations, HER2 amplification, and BRCA1/2 changes have direct implications for targeted therapy and risk assessment. Genomic profiling helps select effective treatments, predict resistance, and personalize care plans, ultimately improving survival and reducing unnecessary therapies by aligning interventions with each tumor's molecular profile. Lung cancer genomics has revealed key mutation profiles such as EGFR, KRAS, and ALK rearrangements that directly inform targeted therapies. Applying genomic insights has transformed treatment in many patients, while ongoing research in single-cell sequencing and AI-driven analyses promises to refine patient stratification and drive the next generation of personalized interventions. To wrap up, we'll summarize the main takeaways about the role of genomics in understanding cancer, the technological advances enabling discovery, and the impact these developments have had on clinical practice. This final section ties together how genomic insights are shifting oncology toward more precise, effective, and individualized care. Recapping the key concepts, genomics reveals the mutations and molecular patterns that drive cancer. Technological advances like sequencing and gene editing have accelerated discovery and clinical translation, and the combined impact has already changed diagnostics and treatment strategies, pointing toward more personalized and effective patient care in the future. Looking ahead, the future of cancer genomics centers on improving patient care through personalized therapies and earlier detection, sustaining research to address cancer heterogeneity, and fostering collaboration across biology, data science, and clinical practice. These efforts will help translate genomic discoveries into safer, more effective treatments and broader access to precision medicine. Thank you for following this overview of cancer genomics. We hope this presentation clarified how genetic insights and advancing technologies are reshaping diagnosis, treatment, and research, and we invite you to explore these topics further as the field continues to evolve and impact patient care.